I've just had a call from a good friend of mine, Jill, who runs a Border Collie rescue centre, and she's just received a really desperate case.
It's early morning, and Scott is on his way to Berkshire for an emergency call-out.
This time it's a 9-week-old puppy. I've never heard Jill so worried before, so I need to get there straight away just to see what's going on.
She was the last puppy left in the litter, and obviously nobody wanted her because of how she is. Oh, she's such a good girl.
Jill's incredible. I mean, she dedicates her entire life to looking after Border Collies that have come from desperate situations, and they come to her house and the heaven that she offers.
Good girl.
She's an absolute saint as far as Border Collies are concerned.
You are a good puppy.
Today, it's Jill's latest arrival, Malala, that she's so concerned about.
I've rescued her from the farm. She's obviously a very poorly puppy. Hey, keep still.
The little Border Collie is badly malnourished and is also struggling to control her head and body.
Hi, Scott.
Oh my goodness, this is a little one for you, isn't it? Hello, baby. Oh my goodness, you're so cute. Oh dear. Wow, she's very floppy, isn't she?
I think she's lucky she's alive, actually.
You've decided to rescue her, haven't you?
Yeah. I just want to shower her with love, really, because she's such a pathetic little thing. And she would definitely have died where she was. Bless her heart. So I'm hoping that Scott will be able to do something for her. It's okay, baby girl. It's okay.
As soon as he examines the little pup, Scott immediately suspects another serious issue.
What seems to be the problem here is that you look blind to me.
Yeah, but she doesn't matter if she's blind.
It doesn't matter. My first impressions of this puppy are not good.
Come on, darling.
Honey.
Hey, good girl.
Oh, my goodness. She's just the definition of neglect. She's very thin, but the most concerning thing is she seems to have this very strange sort of head tilting that's going like this.
Hey, good girl.
She definitely has an abnormal gait. The way she's walking is very stumbly, and she's unable to keep her balance.
Come on. Oopsie.
Oh dear, did I leave my box
Come
in the
here.
way? Sorry, baby. She simply cannot control her own body movements. She's not got just a few issues. There's a lot of issues here. This hip is feeling really quite weird. It's very stiff, swollen joints.
I think she's twisted. Oh, come on. It's all right, sweetheart.
Oh, baby. Oh, dear.
The little pup's swollen joints are obviously painful, so Scott will now take her back to the practice so she can be sedated and given a more thorough examination.
This puppy is in such a terrible state. I am really, really worried about her future. Honey, come on. It's all right. You're safe now. Come on, you're safe now.
In St Margaret's, in southwest London, Border Terrier Wellham looks and acts like a normal, healthy 18-week-old pup.
Oh, good catch.
Especially during playtime with his dad Barder and owners Martin and Helen.
You're doing your biggest brave dog growl, hey?
But in Wellham's case, appearances can be deceptive.
So Wellham's got an issue with his man parts. So I'm not quite sure if this is the right terminology as well, but apparently he's got a micro penis.
They do say dogs take after their owners.
They do, yeah, quite. So despite the fact he's quite a big lad with big paws, he's not going to grow into his manhood.
We aren't going to be the couple with the micro penis dog. We can't take them out anywhere ever again. Wellham won't be able to hold his head up in St Margaret's.
He's going to get bullied at puppy school.
He will get bullied at puppy school.
So easy.
The condition can be serious. If the penis doesn't grow, the empty space around it can be prone to ongoing infection.
He's a big, roughy-tufty puppy who thinks he's a Rottweiler at least, and yet he's got a micro penis. It's awkward, isn't it? Sit.
But little Wellham has another more urgent problem. He's almost 6 months old, but still has one undescended testicle.
Today we're going to go see Scott to talk about the next steps. So after the initial consultation at 8 weeks, we knew he needed to go back to kind of explore what was going to happen.
You're not having it, are you?
If there's no change in his condition, Wellham will need invasive surgery.
I can't say I'm massively looking forward to leaving him at the vet's whilst he goes under for an operation.
Yeah, the idea of putting him under the knife isn't very appealing. Anything to do with an anaesthetic and putting him through a procedure like that, but equally something as intimate or personal as that, I don't want to change who Wellham is.
Good boys.
Hey, come on then. What's this? This is the clinic. Let's go and see the girls, shall we? Hey?
Scott's arrived back at his Richmond practice with little Border Collie Malala.
Hi.
This is Malala.
Oh,
Short.
Lala.
Lala
Hello.
for short.
Lala.
Yes.
Hi, Lala.
Say
You're
hi.
wiggly.
They're met by concerned nurses Gemma and Sam.
Are you wiggly? Oh, what's wrong
She's
with
got a head
her?
tilt.
She's got a little head tilt, and she's also got these very, very lumpy joints, which we're going to look into today. But the saddest thing is that she's actually blind.
Oh, no, Lala. Oh, she's trying to talk to me. Oh, hi. Hello.
Seeing the girls lavish Malala with all their love and attention, it's just so beautifully heartwarming to see. Lala, Lala.
She wants Auntie Gemma, not Uncle Scott.
Come on then, unhand. Come back to Scott. Come on, beautiful. Okay.
Oh.
Come on then, Sam. Let's get cracking. What I need to do now is do a barrage of tests to work out what the problems are caused by and if there's anything I can do to help this little puppy and help to improve her future.
Oh, good girl. It's all right, it's all right. Good girl.
Given little Lala a sedation in order to take some x-rays, but also to be able to look properly into her eyes, do everything I need to do, it's best that she's a little bit sleepier than she is right now. Come on. Let's have a look at some of those joints, shall we?
First up, Scott is x-raying Malala's legs.
X-ray. Right, Sam, so you can see how white some of these bones are here, and yet how almost translucent they are in other places. So this dog hasn't had enough calcium. That very much suggests the old school disease of rickets. Rickets is caused by malnutrition, and for Malala to have such a severe case at such a young age, you can just imagine what sort of appalling diet this poor puppy's had. Her bones can easily break and literally tiny little microfractures develop just so easily because they're so brittle.
It's just so sad that it could have been prevented.
Yeah.
Rickets is caused by a lack of vitamin D, but fortunately with proper nutrition, the condition can be cured. But the little dog's vision loss and severe imbalance are far more complicated.
This case is really challenging on so many levels. Malala's got so many different symptoms that could be caused by so many different things, and also her early part of her life we don't know anything about. What I should normally see in the back of this eye is a beautiful carpet of kind of greens and yellows, but what I can see here is just shades of grey, and I can see them in both eyes.
With a growing suspicion that Malala's blindness and imbalance might be connected, Scott is hoping blood tests will provide some answers.
So I'm taking some blood to test Malala for a couple of things. First of all, there's a few parasites that can affect the nervous system of a young dog and also cause them to be blind. I'm particularly concerned about Neospora. It's a certain type of parasite, a protozoan, that can be present in cattle, and then dogs can get it, and it's very bad news, particularly in puppies.
Should we get some food? What's in here?
The results of the blood tests will take several days, but Malala's rickets treatment can begin straight away with some nutritious food.
The good news is that with good nutrition, we should see this puppy much more comfortable.
Don't gulp it down too quickly. Yourself bellyache.
Scott is also planning to take Malala to an eye specialist to see if anything can be done to restore her sight.
She has literally captured the hearts of every single person at the practices. She means so much to us now, and we're really hoping that this little dog is going to pull through and live a happy, healthy life.
Oh, excuse you. That's what happens when you eat your food too fast, isn't it?
Martin has arrived at Scott St Margaret's clinic with his Border Terrier's father and son, Barder and Wellham.
Hey, Scott. How you doing?
Hey, Martin. Good to see you, mate. How are you?
Yeah, good, thanks.
Hello,
Good, you?
boys. Hello. Are you okay? Hello, monkey. You're in trouble, aren't you? All right. Come on in. Let's have a chat.
Alrighty. Come on, Bard, let's go.
Come on, boys.
This consultation is a follow-up from Wellham was 8 weeks and brought him in to meet Scott for his first round jabs. We knew there were some potential issues with his manhood, shall we say.
Oh, I love a Border Terrier puppy. Yes, I do. How's he been getting on, Martin?
He's been great. He's absolutely brilliant, yeah. Yeah, he's settled in really nicely. Bard has been brilliant with him. We're just going through the teething stages at the moment.
How is our little chap going?
Nothing's come up, so to speak.
Wellham has a medical condition known as a micropenis.
Well, what we're going to do is, if I can just get him leant this way,
Sure.
and then I can just have a look.
All jokes aside, the problem can be quite serious.
It is an issue where they've got a prepuce, which is the sac that the penis sits in, and because it's not being filled properly, it does then expose the dog to infection and build up of discharge.
Scott is hopeful that with time, as Wellham approaches maturity, his penis will have grown to a normal size.
It doesn't seem to be affecting Wellham at all. He's still a boisterous, fun-loving puppy.
Now to find out if there's any improvement in the young dog's testicles.
So what I'm going to do is we'll spin him round, and I just want to have a little feel of his testicles now.
Okay.
Now, the problem we encountered before was that he only had one testicle.
Yep.
His right testicle I can feel,
Okay.
but no left testicle.
No. Okay.
No.
And is that because it's not developed, or is it stuck up inside him somewhere?
Unfortunately, it will mean that it is inside his abdomen.
Okay.
Poor little Wellham has a condition called cryptorchidism, which is basically where one or both of the testicles haven't descended properly into his scrotum, which is the bag on the outside. The testicle tucked up in the abdomen overheats. That overheating can lead to mutation, and mutation is the basis of cancer.
Scott is recommending that to safeguard against Wellham passing on the genetic condition, both testicles will be removed.
He's not really breeding stock.
All right, little man.
Exactly.
All right.
Hey.
Well, you just have to be the fun party guy, won't you?
Yeah, you'll have to be the good-looking guy. Hey, what do you think?
Wellham's surgery will be scheduled a few weeks from now, when he turns 6 months old.
Come on then. Let's go and see that eye doctor. Hey? Yeah, let's go and see the eye doctor. Sounds scary, but it won't be. She's very nice.
Next day, Scott has arrived at the Royal Veterinary Hospital with Malala, hoping for a miracle for the little rescue pup. He's meeting ophthalmologist Marian Matas-Riera.
Hello.
How are you?
Good, thank
and you. Very well. More importantly, this is Malala.
Hello, Malala. Shall we have a look at you, my love, see what we can do for you? So do you want to come to the concert?
Yes, please.
Yes, good.
Lovely.
Let's
Come
go.
on, gorgeous. It might be unrealistic, but I'm just hoping that Mariam will find something that we can do to help treat Malala's blindness.
So what we'll do now is we're gonna dilate her pupils so we can have a good look at the back of her eye. Hey, puppet. Good girlie.
Drops.
This puppy is so gorgeous. She's had such a tough start in life, and now I just want the best for her, and hopefully that means vision.
So I know I look like Darth Vader now with this. But the aim to use this instrument is so it allows me to look at the retina, so at the back of her eye. Okay, Lala. You gonna let me do this? Yes, good girl.
I know. Good girl. Darth Vader is scary. Yeah.
This is very important, my love. This is very, very important, puppet.
Good girl.
Good girlie, my love. Good girl.
Good
There we go. Good
Well
girl.
done, baby.
Okay, so her retinas are not good. Her retinas are really severely damaged.
The prognosis is not looking good for Malala.
her retina is really unhealthy. There's no blood vessels at all, and that is quite shiny, which tells me that is really abnormal. So it's really has degenerated to the point that is nearly atrophied. And that's not good news because it's not a tissue that we can make it regenerate. Once it goes, it goes.
Oh dear. Oh dear. That's no good, is it? Hey, that's no good. The changes present in her eye are something that you don't see very often in puppies, and it does mean that Malala will never regain her vision. Come.
Oh, wow.
Good girl. Where's Scotty?
Dad?
Where's Scotty? Come here.
Despite her blindness, Malala is young enough to be taught to follow voices and the sounds of footsteps to help her get around safely.
Well done. Oh, you're so clever.
Finding exactly what's caused the puppy's blindness and her balance problems is the next big challenge. Scott is pinning his hopes on the blood test results for some answers.
Oh, what a good puppy.
Oh, fantastic.
Sadly, there's no technology here at the RVC that can help little Malala to regain her vision. But on the positive side, I've heard about another special puppy that the RVC does have the technology to help. She's coming in for what's really cutting-edge surgery, and I know everyone here is really excited about it, and I can't wait to hear how it goes.
North of London, young puppy Pippa and her family are getting ready to head off for their appointment at the Royal Veterinary College.
The children adore her, and she definitely makes the house even happier because you're greeted with this bouncy little puppy and they absolutely love it. They really do. Good girl, Pips. Good girl.
Little Pippa has a serious medical condition, and playtime isn't as much fun as it should be.
Oh, poor girl. Look how wet you are. You need another bath. She leaks urine. One of her tubes isn't going into her bladder and it's coming straight out of the urethra, which means the urine just leaks out, which is very unpleasant for her and for us. Let's give you a wipe over, get all that smelly wee off you. Smelly wee. You know, new puppies, you want to cuddle them and love them, and at the minute we just, especially the children, I feel like they can't do that properly at the minute. Come on, baby.
Pippa has already undergone extensive testing at the Royal Veterinary College, and she's booked in today for corrective surgery.
Come on, Pips.
So the procedure that the RVC specialists are going to perform on Pippa is called a laser ablation. And what's super cool is that most dogs will become continent immediately after the surgery. It's awesome.
Hi, Miles.
Hello.
Hello.
How are you?
Nice to see you.
It's time for the young family to hand Pippa over for her surgery.
I will not be able to stop thinking about her. It's like we've got a fourth baby. Give it cuddles. Bye, Pips. Love you, baby. See you soon. She's going for a little operation, so we can't wait for her to come home after. Good girl. Don't get upset. She'll be fine. She'll feel better.
Hey, buddy. You all right in there? Let's see what Uncle Scott says about your little gin.
At St Margaret's, one of Scott's nurses, Emma, is bringing in a very special patient to see Scott.
Hi, guys.
Hey, hello, Ed.
Hello. Hey. Unfortunately, not a social visit, I'm afraid, as much as I wish that it was.
8-year-old Ed is Emma's much-loved rescue cat. She's worried about a nasty lump on his chin.
It's always a little bit nerve-wracking when any of my team bring their animal in, but also I think it's quite touching because they trust me, they want me to look at their animals, and they want me to tell them that everything's going to be okay.
We noticed it a couple of months ago, and it seems to get bigger, and then a few weeks ago it seemed to burst, and now it's refilled again. It's obviously just annoying him. Or...
Yeah, you're not happy about it either, are you? Yeah, I don't like the look of that too much. Let's bring him into the consult room and we'll have a closer look. Hey,
Come on in, buddy.
come on then, champ. Come on, big guy.
Big man. Where's your mum's boy? Hey? Yes, he is.
It's very, very odd being on the other side of the table, actually bringing my animal in for a checkup, not just a social visit. So the nerves are high today, I won't lie.
You know, it looks very cystic, but we also have to think that there is a possibility that it can be one of the more common types of skin tumours that affect people, which is melanoma.
Yeah.
And is he a keen sun worshipper?
Loves to lie in the sun. Loves it.
Clearly that lump is not normal. It looks very angry. It just looks very active. So I do think that we should probably try and get rid of it. Take it out with surgery.
Definitely.
Remove it completely. Let mum feel happier about life.
Yeah.
Then we just wait and see what the results show.
Yeah. Ed is super important to us. You know, he's a member of the family. We don't have children of our own, and he is our child. You know, he's there when you wake up in the morning. He's there when you go to bed. He's there when you're sleeping. He's just there all the time. So, yeah, he means everything to us.
He's such a good boy. Hey?
Honestly, you two need to get a room.
Got a kennel, thank you very much.
You do. Hey, you ready for the big op today, big guy?
At St Margaret's, it's the day head nurse Emma's cat Ed is having the nasty lump on his chin removed.
Thankfully, Ed's procedure should be quite straightforward, but at the Royal Veterinary College, Pippa's surgery is in a whole other stratosphere. They're going to be using high-tech laser surgery, so good luck to Pippa.
You all smelly. Should we get you fixed up today? Good girl.
At Scott's referral hospital, the Royal Veterinary College, Pippa is now being prepped for her operation.
Okay, little wriggle bum. Let's see what happens.
Right. You're going to be super brave, aren't you?
The little dog is constantly leaking urine because of a fault with one of the tubes leading from her bladder.
Good girl.
Yay!
Today, Pippa is not only getting VIP attention from the nurses, she'll also be undergoing state-of-the-art laser surgery, performed at only a handful of hospitals in the world.
The benefit of the laser ablation procedure is that it's minimally invasive and associated with short recovery times, so that makes the whole experience a lot less stressful for Pippa.
A microscopic camera has been inserted up into Pippa's body to show the team exactly where the problem is.
So what we're looking for is the opening of Pippa's left ureter, which is the tube coming down from the kidney into her bladder. And in Pippa's case, that opening is in the wrong place, and that's what we're trying to fix.
My belief is that this is the opening into the ectopic ureter, and that is the urethra up there. And you can see urine coming out.
Professor Hattie Syme is leading the surgical team.
Okay, we're on standby. Do you want the energy up?
I think we can go with 1 and maybe 10 to start off with, please.
So this is the exciting part of the procedure. This is where we can see on screen the laser beam that's cutting away the excess tissue that's causing Pippa's ureteral opening to be in the wrong place.
It's just a bit messy at the moment because we've got a bit of a blood clot, but that's not unexpected because what we're doing is cutting tissue. So maybe come back and have a look from a distance and see where it is relative to the urethra.
If the laser has done its job, it will mean no more leaking urine for Pippa.
Yep. Are you happy with that? Yep.
A special dye is now being used to test the repair.
We can make sure that the ureter is entering in the right place. We can stop there. It's clearly in the ureter and there's clearly no leakage. So we're very happy.
You smell nice.
With the surgery complete, it's now time to wake Pippa up.
You can wake up now. Come on, baby girl.
She'll be closely monitored overnight.
So we're just going to go and pop her into the incubator because she's a little bit chilly.
The big test will be whether she stays dry.
Good girl, Pips.
Okay, little scratch. Ready?
Good boy.
Good. So, ready for a bit of anaesthetic there, champ?
At St Margaret's, Scott is about to start removing a large lump from Nurse Emma's beloved cat, Ed.
I don't think I've ever had you this quiet, Ems. It's quite nice. Mummy's nervous, I can tell.
Mummy is nervous. Mummy doesn't do nervous.
All right, baby boy. He's a good boy. He is. Okay.
You're a good boy. Mum's here.
Good lad. Yeah, it's okay. Look at Uncle Scotty.
It's definitely feeling a lot more real now that Ed's anaesthetised and on the table, and we're about to take him into theatre. It's actually a big deal now.
Let's have a look at this chin, shall we?
With Emma present for the operation, Scott's feeling even more pressure than usual.
I would say it's quite tricky to have the owner being present and actually helping you with the procedure, because normally you act in a certain way with the patient and you need to have that emotional separation. Wow, actually, this thing goes down quite deep. Now that Ed's under anaesthetic, I can feel that this lump actually is much bigger than I first thought. It's about twice the size, really, so it's actually like a pea that's under his skin. You know the rule for trying to remove what is potentially a malignant tumour?
Bigger is better.
And the average margin is about 3 centimetres, which clearly I'm not going to be able to do. Otherwise, I'd have to take half of his jaw off. So it might mean, worst case scenario, if it does come back as something that we're concerned about, we may have to go back in and do further surgery.
Whatever you think is best. I trust you 110%, so
Okay. All right.
whatever you think is best.
All right.
I think it definitely makes me a bit more concerned knowing that that lump is a lot bigger than what I thought was just a superficial cyst. So yeah, I'm anxious to get it off to the lab and see what they say.
So how's the patient going, Ems?
Patient's good. Patient's keeping mum happy for the time being.
I was actually talking about Mum. You all right?
Yeah.
I know Emma very well, and normally she's very calm and very assured under pressure. Definitely more nerves today. You can just see it in her face and her eyes, in the way that she is speaking a little bit less. I can tell that my Em's a little nervous. It breaks down very, very easily. Attach right to his chin as well. Okay, so I think I've got it all out there. Very satisfied that it is now out of your cat. Removing this lump, it really doesn't look very nice at all. It breaks down. It's what we call friable, which is very sort of delicate, and it's very flesh-filled. So I don't know what it is just by looking at it. I don't like the look of it, and I'm really glad that it's out.
It's been a short but tense surgery, and Scott is not the only one who is relieved.
I'm glad we didn't wait any longer to do it. So yeah, feeling better now it's gone.
So, Ems, this black spot on his chin, how important is it to you and to him?
I mean, it's his little beauty spot, so if we can save it. So Ed has this gorgeous little beauty spot on the base of his chin, which we absolutely adore. And it's part of his personality, I think. So if we can save the spot, that would be great. But if he loses a spot and it means that he's safe and healthy and that we've got rid of something that might be nasty, then that'll be okay.
Only perfection will do, is basically what you're saying.
Yes, that's exactly what I'm saying.
It's smaller, but it is still there, and once those sutures come out, it'll look perfect. So,
thank you very much.
my pleasure.
It's like Cindy Crawford without her spot.
Yeah.
Couldn't have it, see?
It shouldn't be allowed.
No, this is where I'm very happy that you are a perfectionist.
I don't know if he's as hot as Cindy Crawford. You're nice, but come on, you're not that nice. Emma did a great job today. She really kept a level head, and although she was very worried about Ed and how he was going under anaesthetic, she kept it all inside. She monitored the anaesthetic beautifully and got the result she was looking for, which is her boy woke up perfectly fine.
Come on then, little man. Come on then, little man. Oh, I know.
But Emma won't be able to relax until she gets the results of the tests on the lump.
You rest up again, sweetheart. You rest up, buddy. All right, little man. Back in a sec.
At Scott's referral hospital, the Royal Veterinary College, an excited Pippa is ready to go home. And little Harry and Mum Vicky can't wait.
Are you nervous?
A little bit.
She'll be fine, don't worry. She'll be fine. She'll be all better. All her problem will be sorted, okay? I wonder where she is.
We're going to pick Pippa up today and I'm really excited to see her again. When we get her and go home, I want to just play with her and be happy that she's back.
Pippa, who's that?
Hello.
There you go.
Hello. Hello, baby.
Hello. Excited to see you.
Hello. We've missed you so much. You've been a good girl. Yeah.
So Pippa's been doing really well since her procedure. We haven't noticed any dribbling in her kennel. Her bedding's been nice and dry, and she seems really comfortable. So really good signs. Yeah, really pleased with how everything went.
It's great. Thank you so much.
Yeah, you're welcome. Not at all. It's a pleasure.
Oh, come on. Thank you so much. I'm so pleased the procedure's all done and we can enjoy her and hopefully no more problems. We can enjoy our little dog. Oh, good girl.
At Scott's Richmond practice, rescue pup Malala's blood test results are now in.
Toxoplasma. Negative. Excellent. Very good.
Scott is hoping to find out why the young dog is blind and struggling with her balance. He suspects a dangerous parasite called Neospora could be the reason.
Neospora. More than 1,600. I'm totally shocked. The results are in and the Neospora level is just through the roof. So she has definitely been exposed to this disease.
Neospora is a potentially fatal parasite that attacks an animal's brain and spinal cord, gradually shutting down their body.
Gutting. Most of the time, puppies or dogs that get Neospora end up dying from it. It's a nasty condition. It causes all sorts of things from ascending paralysis where they just get weaker and weaker. They can't eat. They have liver problems. They have breathing problems. They have muscular spasms. It's a horrendous condition.
Oh, good girl. Was that nice?
The little pup is waiting upstairs with Nurse Sam and receptionist Kirsty.
Hi, guys.
Hi, Scott.
Hey,
Teaching her a few tricks.
Oh, yeah?
She's doing very well. Very well.
Good. Well, I'm sorry to be the deliverer of bad news, but unfortunately I've just got the blood results back and she's got Neospora, which is pretty bad. So it basically means that she does have neosporosis, the clinical disease, and unfortunately at any point she could deteriorate badly. And we're talking paralysis, we're talking unable to walk and swallow and liver problems, breathing problems. It's hideous.
Malala will be started on a course of antibiotics immediately to hopefully wipe out the parasite. She now has a tough battle ahead of her as her body tries to fight the disease.
I'm so sad. Just seems to be one thing after another that we keep finding. It's not fair, is it?
I'm willing with every part of my being that this beautiful little dog gets through okay. Such a good girl. Hey. Yeah, that nasty Neospora isn't gonna get you, is it? No. No. Hey, you so nice. Hey.
Morning, team.
Hey, Ems. Hello, little Ed.
In St Margaret's, it's been a week since Nurse Emma's cat, Ed, had a nasty tumour removed from his chin. And today, the results are in.
We're back again.
Yeah, he has been a little bit of an headache, hasn't he, of late? He has.
How long did it take you to come up with that one?
Oh, a good couple of years, yeah.
I don't quite know how to put into words what I feel about Scott's puns and his bad dad jokes. It's just Scott Miller all over.
Despite her brave front, it's been an anxious time for Emma.
Hate waiting for results. It's literally felt like this has been the longest wait.
All right, then. Let's get you into the consult room and we'll tell Mummy some news.
Yes, please.
Emma has been incredibly worried about the result that I'm going to be giving her today regarding Ed's tumour. It was a very angry, very fast-growing tumour, and Emma knows that they are all the indicators of a potentially aggressive tumour, something like cancer. I know how much you've been worrying about this result. Yeah.
Go on.
But the news is good.
Is it?
Yes.
What is it?
It's an apocrine cystic papillary tumour, which isn't a very common tumour at all. In fact, the pathologist had barely ever seen it. But the good news is that it is benign, and hopefully by removing it, it will never come back.
Fantastic.
Yeah.
Oh, isn't that good news, bud? Hey?
I am so over the moon that we have got the results for a benign tumour. That is the best news we could have hoped for. So I'm just enjoying the news that we've got the all clear. Oh, I'm so pleased. Are we pleased?
Hey, you pleased?
Are we pleased?
You happy?
Say thanks, Uncle Scotty.
You don't have to worry. No.
Thanks.
He is such a beautiful cat, and I would say that he's head and shoulders above the rest.
Oh no, it's just getting awkward now, isn't it, mate?
Hey.
Oh, I'm just gonna
Take your cat away.
my cat.
Yeah. Save him from the bad jokes.
Bye now.
Bye, Ed. Bye. I think he liked it. Yeah. You gonna be a good patient today?
Yeah. You don't be nervous. This is going to sound really wrong, but I'm looking forward to seeing the size of this penis.
Wow, that's something you've never uttered to me before.
At the St Margaret's Clinic, it's time for Wellham's surgery, with nurse Gemma assisting.
There we go.
Yeah. That's not too bad, is it? Brave boy.
6-month-old Wellham is having both his testicles removed. But first, Scott wants to see if there's any good news to report on Wellham's micropenis condition.
Now that Wellham's well and truly under anaesthetic and he's nice and asleep, we're going to just examine his equipment and just see how it's getting on. Well, it does seem like the young man is, he's certainly gained
Had a growth spurt.
Yes, he has gained some inches, which is great. I mean, he's really filling that sack now. I can leave you Willie alone, mate, which is good, isn't it? Yes, a man's prerogative is to have it left alone when he wants it left alone.
So it's just a normal penis, not
Yeah.
micro anymore.
Not
Well
micro,
done, Wellham. Your dad will be very proud when we tell him.
but we'll have to prepare for removing this testicle and then going for our fishing expedition.
Wellham also has a condition called cryptorchidism, where one testicle hasn't descended. So it's best that both testicles are removed.
All right, let's see if we can find this testicle, shall we? So we know it's on the right-hand side. That's it. So now I know where I need to go in. I need to go in right there.
Yeah.
It's almost certain that when a dog suffers with cryptorchidism, which is basically where both testicles aren't in the scrotum, that it is genetically inherited and it can be passed on from parent to offspring. So as far as Wellham's concerned, it's the right thing to do medically, but also ethically to ensure that he doesn't pass this on to future generations. So I'm ready to make my first incision. Right, so I've got it. He's a little fella, but perfectly formed, and thankfully it's come out relatively straightforward. So now his testicle, it's now going to be taken away. So that's just about the first one closed up, and then we can move on to the testicle that's in his little scrotum there. So you can see that's significantly bigger on the other side.
And there they are, in all their glory. Very beautiful.
Really?
No.
There you go, Wellham. Two nice little suture lines. No other boy will be able to tell the difference. Yay.
Hello.
Oh, sweetheart.
Well done. Oh, Bubba. Oh.
Yeah, you're all right. You're all right.
He's probably going to be feeling a bit groggy and not really 100% coming around from the anaesthetic because of all the medication. So he's coming around nicely, but yeah, he is being quite vocal. Oh, Wellham. We're breaking our hearts.
Come on, you're okay. Come on.
After the successful operation, Wellham is making his feelings known.
You tell me all about it. Yeah.
Hi, Gemma.
Hello.
Thought we'd bring Border with us for the pickup.
Ah, you come to see your boy.
Quite like being back on your own, haven't you?
Oh, you had Mummy and Daddy to yourself.
Well, have a seat. It's got to be up shortly.
Cool.
Okay, all right.
Upstairs, owners Martin and Helen are looking forward to being reunited with their little boy.
If he's in any discomfort or pain, then I think he'll like to see Helen anyway. He's quite a mummy's boy.
Hi, guys.
Hey, Scott.
Hey, here's your boy.
Hello.
Hello, little man. Hello. Oh,
Hello, mate.
Oh, look, both daddies are very excited to see you. Hey.
Hello, Papa. Yes, hello. I'm here. I know I've got you.
It's been quite a traumatic day for poor little Wellham.
Silly cone of shame's in the way, isn't it? I know, I got you. I got you. Hey, such a wuss when it comes to cuddles with me, aren't you?
Furry baby.
It's really lovely to see his whole family turn out to welcome him back into the fold with Helen and Martin and also Dad Bardo.
There he is. Here he is. There you go.
Well, good news is, Dad, is that your boy could no longer be classed as having a micro penis.
It's great news.
In fact, he has, well, I suppose, a normo penis. But as far as the testicle is concerned, that's also good news. We removed the one that was internal, and although quite a lot smaller than the other one, perfectly formed, no form of cancer or anything present. So that's really good news, isn't it, mate? Yes. And then, of course, he's then been castrated in the normal fashion. Yep. So I noticed that Dad is very closely looking at my handiwork. All right, guys. All right. Take care.
See you.
Cheers, guys.
See you soon. Take care.
Cheers. Bye.
See you, Gemma.
Bye. Bye, boys. Come on, little man.
See ya.
He doesn't seem that bothered, does he?
No, you're totally fine.
It's just the cone of shame that's the problem.
I think he's still friends with you.
Next day, Scott has a special delivery to make.
There's my baby. Hey, come on. There's my baby. Come on. Good for you.
It's a big day for little rescue dog Malala.
Hi, Jill.
Oh, hello,
I've got
Scott.
your baby.
Oh, Malala. Hello, darling. Hello.
The young pup is finally well enough to be reunited with her devoted carer Jill.
You home? Yes, you're home.
It's always a wonderful feeling to come back and see Jill. But even better when you can reunite her with her baby, Malala. Malala's just such a beautiful little dog, and she's so plucky and tenacious that I'm sure that Jill missed her a lot.
You home?
Scott has been treating Malala for 6 weeks for a deadly parasite that has left her blind and attacks the brain and spinal cord.
Good girl.
For now, antibiotics seem to be keeping the problem at bay. But she's not out of the woods and needs to be closely monitored for the next few months.
What it means is that Malala is under a bit of a dark cloud. At any point when her immune system is weakened, all the clinical signs that we saw right at the start can happen again. She's on the right medication to protect her from getting any worse at the moment.
Yeah.
We need to make sure she's as healthy as possible, as stress-free as possible, to keep her immune system as strong, to keep fighting the disease, because if she can get to her first birthday party, her prognosis improves dramatically. Research has shown that if a puppy gets to their first birthday, there's a much better chance that they actually don't have the disease that will linger long term, which should mean that if she gets to that first birthday, life is good.
Well, I'm glad she came to me anyway, because she wouldn't be here now, probably.
Oh, without doubt, Jill. And I know that you're the one that will help her through this.
Oh, I will. I will. Won't we, Malala? We all will, because we love you, don't we? Yes, we do. She's got to get better for all of us. She's too much loved for anything to happen to her. We'll just fight it together.
Should we show Mummy the dance? Hey? Should we show Mummy the dance? Lala, ready? Lala. Lala, come. Oh, she's making me look like a fool. Lala, good. What are you not dancing? Malala and I decided at the clinic that we were going to perform a little dance routine to perform at her first birthday party. Lala, come. Come on. I worked out that she would follow the tap of my feet and then she would dance around me. Lala, spin. Oh, my goodness.
She says, why are you doing that?
I know. But as soon as we get to Jill's place, she leaves me hanging. I'm dancing around like a lunatic, but at least Jill found it funny.
No,
There we go.
that's it.
Here we go. Through the legs. Through the legs. Yay! Good girl.
There's room for improvement there, I think, but Malala did well.
That's a good girl. That's it.